my mind, the number one purveyor of anti-fat bias and weight stigma is public health industries. And because of that, navigating the healthcare system as a fat person can be a literal nightmare. It is difficult to advocate for yourself as a fat person when you might not feel equipped with adequate resources or knowledge, and it is easy to cross your own boundaries when engaging with the healthcare system, especially when healthcare providers are the literal gatekeepers standing between you and something you need. Cara Marks is a registered massage therapist and is working towards a career as an osteopath, which means that her job involves literally working hands-on with the malleability of her patient's flesh. In this episode, Cara explains how she approaches such vulnerable work with patients of different sizes and how to have conversations about chronic pain, illness, disability, and other health concerns without perpetuating fatphobic ideologies.
My name is Cara Marks. I'm a registered massage therapist, and I'm also studying to be a manual osteopathic practitioner. My pronouns are she, her, hers, and on the fat spectrum, I identify as a small fat.
I'm really excited to be chatting with you today because I think that as a healthcare practitioner, but specifically as an RMT, you are literally working with your hands with the malleability of the body. And so I think being someone who is in direct contact with people's bodies, perhaps even sometimes in their most vulnerable moments, is a unique opportunity to talk about how fatness might influence healthcare and healthcare practice. So to begin, I would really love to hear about your experiences first on the other side as a patient. So have you ever navigated those same spaces, but sort of on the not the other side of the table, I guess on the table is how I would ask that.
Yeah, on the table, yeah. Let's more specifically, maybe I'll talk more about when I was in school and being treated, because we would treat each other a lot. And so I'd gone to a handful of RMTs before I entered massage school. I was definitely the only fat body in my class, and was kind of used as an example a few times without my permission, but that's another story. But there was definitely kind of, for newer RMTs, like almost a confusion about like, how do we deal with what we refer to as adipose tissue, which is just the medical term for fat. How do we bypass it? What does it do when we put our hands on it? Like specifically when we're working on stomachs or say areas that carry more fat, like your glutes or your thighs. There was just kind of this, like, I felt the intention from these therapists was quite confused in what they were trying to feel on my body.
Did you feel like your instructors had the knowledge to not only answer those questions, but also then teach the other students in the room how to work on fat bodies?
Some did. Not all our instructors were RMTs. We had quite a few chiropractors who were instructors as well. And the chiropractors were quite like rough and tough about it. They were like, you just go in, you just bypass it all and you just go in. So it was quite like a little weird. And the RMTs were more about, like, we talk a lot about like sinking and meeting the tissues where they're at and things like that. So there was just conversations about like sinking through adipose tissue. Like the muscle will come to your hand. You just gotta like take your time with it. So
Interesting. I hadn't even thought about that, about whether or not in your training and shame on me for not thinking about this actually, because it's so critical to this conversation, but in your training, whether or not that was a factor or not just added sort of as an aside, but an explicit sort of pause, I guess, to make sure that people knew what to do when a fat client or patient was on their table. Did you find that the other students saw the importance of that?
I did, but I think it made them uncomfortable because like anybody who's been to some sort of medical practitioner in a fat body, you can see the discomfort on the practitioner's face of like, how do I ask them? Are they going to be offended if I ask them? How do we approach this? Should we just be more conservative and just avoid it completely and just do what we can? So there was definitely, I think, more moments like that of like kind of like just more discomfort in the room. Like there was, for a specific example of what happened to me one time in class, I was the body for an example from the teacher, the instructor, and they made a point to say, oh, Cara has a larger body, so we need to lower the table more to be able to get the force that we can get. And so made example of the fact that I was a larger body and what you needed to do. However, you know, I had a friend come up to me afterwards who was very petite and was like, she's like, oh, like, I can't believe they called you out like that in class. I'm like, it's like for having my body type, like,
Right. You're like, we can both see what I look like right now.
Yeah. So, you know, like, I know she was just trying to, you know, be an ally and advocate for me and make sure I felt comfortable in that. But I was kind of like, I don't know, like, I'm pretty comfortable in my body, thankfully. Took years and years of work, but I'm here. But yeah, she was just like, she was so offended that like the teacher mentioned that I have a larger body. So
oh gosh, it's an interesting question though. And I remember I was doing a consulting gig. I was invited explicitly to this clinic for people with scoliosis to talk about what it would be like to add fatness to their sort of repertoire of things they're aware of and into their practice. And the room was full of thin practitioners, which I expected. And one of them very genuinely asked, you know, how do I approach that conversation with my clients, with my patients, when I might perceive them as being in a larger body, but I don't know how they identify. And I want to bring up the fact that, you know, their size might impact the work we're going to do together, the work I might have them do at home, et cetera. And so when you're in those situations with your clients or patients, what do you do? How do you approach that?
I just speak very anatomically to them because that's what we're doing. We're working with their anatomy. And so if I need, say somebody has an apron belly, I need to access their hip flexors. I just say to them, well, first, obviously, I obtain consent that they're comfortable with me working on their abdomen. They're comfortable with me moving their tissue. I just say, you know, this is where I'm going to be accessing your hip flexors. You know, they're just a little bit medial to your hip bones. In order to access that, I'm going to have to maneuver around tissue. Are you comfortable with that? Most of the time, the answer is yes, because we've kind of shown and we've created a relationship and I've shown them where I'm going to be working. And then you just have to move the tissue sometimes. So I just explain to them that, like, you know, in order to access into your hip bone, I'm just going to have to move the tissue a little bit more into the medial line. And then I can access the muscle.
Do you find that making those adjustments makes your job harder? Because I know that there are, well, in BC, there was this proposed legislation that surgeons who are operating on fat bodies could charge more because it was the surgeries would take longer or there were other factors to consider when operating on a fat body. And it really sounded in the discourse about that legislation that there was a frustration, almost like operating on fat people was a burden. And so considering that there are adjustments or additional steps in your practice when it comes to practicing on fat bodies, I mean, I know that this is a leading question because you are also a fat person, but what do you think, I guess, maybe the overall sentiment is about working with fat people in that specific capacity?
I don't think, like, I don't know. I'm a big proponent of saving my own body so I can have longevity in my career. I get all of my patients to help me. If I need to like do something with your hip, I'm getting you to lift up your hip. Or lift up your leg so I can access into your hip. And then I'll use more of my body. I don't find it more or less difficult per se. Somebody's already lying down, their tissues are already relaxed. You know, all I'm doing is just kind of moving something over. It's not expending that much more energy than if I was working on somebody with a flat stomach or, you know, somebody who was a size 4. Yeah.
What are some of the steps that you have taken to make your work a fat positive practice?
So I haven't really done anything. This is the crazy part. Being in a fat body has made my clients, my patients who are in fat bodies as well, feel more comfortable. And then I hear, unfortunately, all the stories and the experiences they've had. I have a couple of patients who both see myself and other practitioners at my clinic, and they just say, oh, this, you know, they don't understand quite the same way because, you know, they just keep telling me to lose weight or, you know, in order to be pain-free, I should probably lose some weight or, you know, exercise more or do these things that aren't within my capacity at the moment. And they feel comfortable telling me these things because I can relate. So it sounds bad that I say that I haven't done anything actively other than be fat myself.
But bringing your lived experience to your practice is actually like a really significant thing to do and a very meaningful thing to do.
Mm-hmm. And that's it. I think it's empathy. Mm-hmm. It's empathy for what they're going through, trying to access healthcare, alternative healthcare, and manual therapy in a fat body.
I feel like there's usually, a lot of fat folks. I would almost argue that every fat folk has had that nightmare. Every fat person has had that nightmare of sitting on a chair and having a break. So how does it work with the tables that you practice on? Like, what are the different considerations when it comes to having a fat patient on that table?
So it depends on what type of table, because most established clinics will use an electric or a hydraulic table. And those ones can, their weight limits are upwards of 2,400 pounds. So usually I'm not too worried. But if we're using one of those portable tables, they're about 250 to 350 pounds. The way I practice now too, I'm getting on the table with people sometimes because I need to use my body to help like maneuver and or to do a certain technique to apply pressure. So we also have to take into consideration not just the weight of the person on the table, but my weight too, and the pressure that I'm using.
Right.
So the electrical, and the hydraulic tables, I'm not really concerned. I have never, ever heard of one breaking underneath anybody, nor have I with the portable tables either, but I just would never get onto a portable table with somebody else on it if I was to ever be in that situation.
Right. Of course. That makes sense.
Yeah.
This is a question that I want to ask, and I don't know how to eloquently word it. So I'm going to ask for forgiveness in advance. But are there certain health considerations or physiological factors that are specific to fat people? And that's not to blame fat people for certain conditions, but also to embrace the reality of the needs of fat bodies specifically.
The only thing that I've ever encountered for fat bodies specifically is ulcerations and skin folds. So if somebody has, enough, has fat on their body that is creating a skin fold, and for whatever reason it's become raw or ulcerated in some sort of form, then it becomes a bit of a health hazard, and we have to be very cautious about it. Obviously, it's painful. The person can feel it. They warn me beforehand. But other than that, things that we typically assign to obesity as these are fat people health things like diabetes, hypertension, the amount of straight-sized people that come into my room that have diabetes and hypertension and all of these obesity-related diseases is probably more than what I see in fat people.
It's interesting because I have spurs on my ankles and my knees, and I have garbage ankles. I roll them way, way too often. And I think that, as a fat person, you're always told that you need to lose weight because you're putting too much pressure on your joints. And I just have this image in my head of my knees and my ankles disintegrating inside my body. And then when I really damaged my ankle one softball season. And so I went to a physio clinic that was specific for athletes. And every time I went, I already felt the kind of resistance or hesitation in the clinic, or I just felt so out of place. And I would always forget to bring shorts. And so they would give me, the largest size that they had. Of course, it didn't fit. The entire experience was just really uncomfortable. But it definitely made me, or reaffirmed this thought process in my head of, if I wasn't fat, I wouldn't be here. I wouldn't need these services. And of course, that's garbage because the entire industry has survived as long as it has because there's a need for it regardless of size. But I couldn't help but not be able to tease apart that connection between fatness and ailment that we hear so much about. And it's really refreshing to hear you also say that these different conditions that you come across in your practice don't discriminate based on size, that it's actually correlation does not equal causation kind of thing. And I think that's especially reaffirming to hear when you are in a practice that is really getting into the tissue and literally touching people's bodies in this very vulnerable way.
Yeah, 100%. And we also have to remember a lot of these conditions that we put on fat people are like diabetes is 80% genetic. It's 20% lifestyle. You know, if you could be a straight size 4 person who's athletic and eats reasonably well, but if you have diabetes throughout your entire family, the chances are at some point you're probably going to get type 2 diabetes. It's just that's the nature of it. And that's information from a friend of mine who's a dietitian. So, yeah, so we really have to put that into perspective too. But there's that correlation that obesity has a direct relationship to lifestyle. And that's just not true. And I see it all the time in my practice. So.
Do you ever find yourself in the position where you are constantly having to dispel these myths or these stories that dominate public discourse about fatness? Do you find yourself more on the defensive in your industry as someone who operates from a fat positive perspective?
I don't want to say defensive. I try to come from a place of warmth and kindness to yourself. So I don't ever want to be defensive about something. Because I'm more about like acceptance of where your body is at. But there are times for sure, like when somebody comes into my room and they're like, well, my physio said if I just lost some weight, my knees wouldn't hurt so badly. I'm like, why don't we try and create some strength instead? Like, why is weight loss the only option to support your knees if they're unstable? Say you've had a ligament tear or something like that. Why is the only option weight loss? Why not strength?
I started saying to some of my healthcare practitioners, how would you treat a thin person with these conditions? I'd like to try that. And often they kind of look at me as if that is absurd, but you can see the wheels turning in their brains where they're like, oh yeah, I do have thin patients with these conditions, and so I can offer you another course of treatment. It really kind of blows my mind a little bit that it doesn't occur to them either, you know? And also just statistically, the fact that weight loss is not sustainable or achievable, I'm always like, okay, cool. And then I hate to say it, but what fat person hasn't tried to lose weight at some point in their life? So it's sort of like, okay, cool. Thank you so much for prescribing something that I probably have an unhealthy history with. What else can you offer me? But I think with healthcare practitioners, especially specialty healthcare practitioners, we are seeking their services because we have a need. You know, you have an injury or what have you that you'd like to have some rehab for. And so sometimes I think fat folks will bend themselves to the mercy of these practitioners because you're like, well, you have something that I really need. It's hard to get an appointment with you. It's expensive to have an appointment with you, all of these other things. And so I'm going to sort of play to your sensibilities to make sure I don't make you uncomfortable so that I don't compromise the quality of the care that I'm going to receive. Do you feel like the quality of care that fat folks receive when it comes to RMT practices or being an osteopath, do you think that plays a factor? Do you see people playing into the sort of good fatty narrative or a compliant narrative or making themselves as small as possible?
I do. Yeah. No, maybe not so much with myself, but it's from the stories I hear from my fat patients who have gone to straight size practitioners beforehand that, you know, they're like, well, I didn't want to tell them that this hurt, or I didn't want to tell them that like when they moved me like that, I couldn't actually get in that position, not because I didn't have the flexibility, but because my belly was in the way, or, you know, my thigh fat wouldn't let me like go more into the midline or something like that. So I don't think it's so much about them fitting into that good fat like persona, but more just like how do I tell them that what they're doing is not a limitation because of because of say the joint, but because of my the fat on my body. So it unfortunately affects their treatment because they're not actually getting a full stretch, say, in their hip if we're trying to move their hip into the midline and stretch out their glutes, because they're too shy to say to the therapist, I need to move my thigh fat out of the way so you can go a little bit deeper.
What do you think would encourage fat patients to take up more space in that way or to be more bold?
I think I think it's practitioners naming that they're fat positive in their practice, because I think it's about coming into the space and feeling comfortable. I don't know how that looks. I don't know how we change that narrative yet. I wish I did, but I think it's something we're all constantly working on. But on the patient's end of it, how would they? I think you just have to say it, because the thing is, most practitioners, I don't want to put them all in a box, will comply to what their patients want and need. And it might, if the first time you say it to a straight size practitioner, they might get a little scared and like, oh, okay, you're like acknowledging your fat on your body.
Right.
This is weird. Like, I've been dancing around it this whole hour. Now all of a sudden you're telling me that you're fat, even though we can both see it. But if you maintain a relationship with that said therapist, it's almost like you can train that therapist to be comfortable with your fatness and to be comfortable with your body. If you're just like, here, let me help you understand what's happening with my body. Let me help you understand how you can maneuver my body that's best for both of us. So I think it's a bit of education on both ends. And that's just going to have to be finding a practitioner who can meet you with that compassion. I know not all practitioners fall in that realm, but finding a practitioner you like is kind of like dating. You got to try a few. You've got to kind of shop around a little bit. You're going to go on a couple good dates. You're going to go on a couple bad dates. You're going to have some not so great experiences, some amazing experiences, and then you'll find somebody who really works well with you.
I think, too, when you find the practitioners who just have that safe space or that offering, we will cling to them. I know you're a member of Fat Club Vancouver. That's how we were connected. And I can imagine that when people find out about the services that you provide, that people must flock to you, because I don't know that it's that common for people to just be explicitly fat positive. They might say that we practice on all bodies, or we might have a diverse clientele or what have you. But it's nice to hear people specifically name the different types of bodies that they are comfortable with or familiar with working on.
Yeah.
And I imagine that you might have a devoted clientele who would follow you from practice to practice or throughout your training or what have you as well.
Yeah, I'm very fortunate in that way. I have been practicing for a long time, as well, 9 years now, and I have developed both of straight size people and fat people, but there's definitely a specific special relationship I have with my fat patients, of an empathy and an understanding I have of what they're going through, and how to navigate their bodies.
I feel like, too, in your practice, you also are probably, through your work, helping people connect with their bodies, too, because part of the fat experience for a lot of people is disassociation. And so having that hour of focusing on the materiality of the body can be a really challenging thing, but also what a gift to bring people into focusing on the immediacy of their flesh and locating feelings, whether that be pain or what feels better or what have you. I think it's more meaningful than perhaps we would think of at first thought.
Yeah, I definitely agree with that, because, well, and lack of body awareness is quite universal, actually, to be honest. Like, when you said that, definitely disassociation from our bodies as fat people. We've all been through it. Like you said, most of us have tried a diet. Most of us, I don't want to say most of us, but there's a large portion of us who've had some sort of form of eating disorder, disordered eating in our lifetime. But I do see it in straight-sized people as well. People are very, like, when I explain to them what's happening in their body, there's a lot of, like, aha moments and, like, oh, wow. But there's definitely, I find with people in fat bodies, they haven't ever had therapists explain to them. Because I think yet again, we talk about that, like, kind of hesitation a lot of therapists have of not acknowledging fatness and not acknowledging that the body on their table is fat.
Right.
So.
And speaking to it.
And speaking to it is more importantly, yeah.
Oh, interesting. Direct communication. Who knew that would be such a life-altering thing?
Yeah.
We have kind of gotten into this, but I want to ask it in case there's something else you can think of. But what do you think it will take to have widespread access to quality care?
Oh, that's a big question. And do you mean care within the manual practice field?
Yeah. No, I won't ask you to solve the problems of the entire medical industry.
I was like, because that's a very large issue, and I have many thoughts on that. But, I think when we're in school, we need to have somebody like yourself who does consulting come in and talk to students. We need to start them in their practice to learn how to communicate with fat bodies and how to communicate with all different body types on their table. Because, in passing, we're always told to be inclusive and you have to touch all body parts and all types of bodies. And this is what you're going to be faced with. But we're not told how to. We're just told that we're going to. Mm-hmm. And so I think having people come in as a part of the curriculum to actually educate the students, both in pretty much in any manual therapy, physiotherapy, RMT, osteo, chiropractics, even acupuncture.
Yeah.
I think it would be hugely beneficial. And I think that would be a way of kind of starting at the beginning and letting these students go out into the world after they've done their schooling, understanding the bodies, not just knowing they have to touch them, but understanding them.
I think too, even just being familiar with having uncomfortable learning experiences where you're invited in to have that uncomfortable conversation that you might feel shy about. Doing that a few times I imagine it's not just fat folks who they're going to encounter who they might feel overwhelmed by or unfamiliar with. And so it's nice to think that perhaps just practicing those uncomfortable conversations could actually really benefit folks in the long run so that they're more open to do that on their own once they branch out or finish the program or what have you.
Absolutely. Yeah. It's funny, becoming a therapist, we, all of us always joke, you kind of attract a certain demographic.
Right.
My demographic seems to be a lot of Ehlers-Danlos syndrome, fibromyalgia, chronic fatigue syndrome, all of these kind of unknown disorders that are kind of slapped with names on them. But a lot of the people who have these also live in fat bodies.
Oh, that's so interesting. I didn't know that there was so much overlap between those specific conditions. And I'm not surprised because I do know that those conditions are under-researched and underfunded. And there are usually not many treatments that are prescribed. It's sort of like you have to live with it, good luck kind of diagnosis. So how do you approach that conversation? Because I think especially with something like chronic fatigue syndrome or fibromyalgia, it is very easy for fat stigma to creep into how that is viewed or how that might be delegitimized. And also how we might be afraid to approach care or gentleness to a body with that condition.
That's a bit of a difficult one to answer for me about how would I approach it, because I think I just approach it yet again, like I've said many times, with empathy. And because myself, I have an autoimmune disorder. I have a reactive arthritis disorder that affects my joints, and I live with chronic pain. And so it's something that both I live in a fat body and I have chronic pain. So when somebody comes and is on my table with both these things, I know what their lived experience is. Not exactly, but I can empathize. I recently had a patient of mine, this is me practicing being okay with having compliments, but she told me finding me was life-changing because it was the first time that she's been able to just come into a room and of all of her practitioners and feel like they can just tell me what they're feeling without feeling like somebody's going to go back to weight or somebody's going to go back to oh, well, you have this, or, just like someone is meeting them and just listening and just caring.
A few years ago, I was diagnosed with a condition called idiopathic intracranial hypertension, which mimics the symptoms of a brain tumor. And this was terrifying to figure out, but it was also incredibly frustrating because it is most prevalent in AFAB folks, women, I guess as a general term, who, according to medical lexicon, are overweight. And so I think because of misogyny and fat stigma, it's under-researched and underfunded, and the treatment is to lose weight. And it really angered me because when I found all of these sort of online communities of people with IIH, a lot of the time they would say, I lost a significant amount of weight and it either made my symptoms worse or it hasn't gotten better at all. And so with this one ophthalmologist at VGH, immediately she told me to lose weight. And she told me to lose about 20% of my body weight without asking me what I eat, without asking me my lifestyle. And not that those things are indicative either of weight and whatever. That's a whole other conversation. But I remember this was one of those practitioners where I had to say, what would you tell a thin patient with these symptoms? Because that's what I would like to talk to you about, because it just got so frustrating working with this one practitioner. And I do think that any kind of autoimmune, chronic pain, anything like that, it just immediately defaults to, well, there are things that you can assume responsibility for and you can make better for yourself. And then at the same time, as someone with chronic pain as well, I don't want to negate that personally for me, moving my body in certain ways does alleviate some of that pain. But it took years of working through the layered elements of shame and the fat experience to be able to even say that out loud right now, speaking to you. Because I think, as you've said, the overlap between disability and fatness is present in your practice, but it also just adds these layers to working with the body in ways that can be triggering, re-traumatizing, what have you. So, like, what kind of conversations are you having about those overlaps with your patients, or like, what are some of the discussions that come up in terms of the fact that a lot of the people coming to you for care are also fat?
Well, and it's not in my scope of practice, but like I just listen, like I just let them get off their chest all of these other experiences they've had and just let them know that they've been heard and that what they're experiencing and the pain they're feeling and what's going through their body is not, like not a part of their fatness. It's what they're experiencing, and that what they're having is just a lived experience. And we're humans and we all have it, whether you're in a fat body, a straight size body, we all have lived experiences, and that's theirs. And that's kind of where I approach it from. And like that their lived experience deserves to be heard. And that's kind of how I approach all of my patients. But like specifically, it has the largest effect on my patients whose intersection is between disability and fatness.
Like, it's so interesting. I feel like chronic pain is often framed as our punishment for being fat, and that it's something you have to accept or live with. And that can be chronic pain from physiological circumstances. It can be chronic pain from not being able to fit into seating and having to like constantly make yourself uncomfortable or what have you. But it's really nice to hear a practitioner validate those experiences and then also explore the possibility that maybe chronic pain is not just your, as I said, punishment for existing in a larger body.
It's just your experience. Like, and my brain, I'm a puzzle piecer. Like when somebody starts telling me about their chronic disorders, I'm always like, ooh, what's kind of going on? Like how is this affecting? And I usually don't take the conventional route where someone says like lose weight. When you started talking about your idiopathic intracranial hypotension, my brain goes to something which is a very osteopathic way of thinking, is pressure systems in your body. And our body works on different levels. Like we have different diaphragms through our body. And it's like, if your thoracic diaphragm is too much on inhalation, it's going to push all this pressure up into your cranium. So maybe it's not about fatness, and maybe it's about your diaphragm's just really tight, or maybe there's some issues with diaphragmatic breathing. Anyway, sorry, a bit of a tangent there, but
no, it's super interesting. So how would you treat that? Like, is it possible when you're treating fat patients to manipulate the organs in a way?
Absolutely. And that's one of the big things I do as I'm going through my osteopathic training. A big part of what we do is something called visceral manipulation. It sounds very aggressive. It's very gentle. I don't love the word manipulation in there, but we're working with the fascial tissues around the organs. When organs are not functioning properly, sometimes there is an aspect of them that is structural, and it is because they're like sitting too high up in a cavity, or they're stuck against a wall of a cavity, or they're stuck against something else. I see a lot of bladder and uterus stuck together, things like that. So yeah, we just manipulate around the abdomen, we like the same thing as like I was explaining with the hip flex, accessing the hip flexors, is we just have to have a conversation. And obviously all of this I obtain consent for. We have a conversation first about what I'm going to do, how I'm going to access it, what I might need to do in order to access it. And as long as the person's comfortable with it, we just go ahead. Like if I need to get into somebody's, large intestines, I'm just going to have to go through the fat tissue. Like that's whether you have a little bit or a lot, like I have to get there if we want to work on it. So
this is fascinating to me. I've never thought about massaging my organs to like help with anything, but now it's like all I can think about booking is a treatment to try to explore that and see like what's going on the insides.
Well, it was just so funny. Like a week ago, I remember popping into my colleague's room today and I'm like, oh my God, like 5 out of my 7 patients today were constipation patients. I'm like, I moved so much poop today. Like,
oh my gosh, that's hilarious.
Like, it's like, and I love it. I love helping people in that way. But, constipation isn't exclusively for straight size people. Like,
right. No, it's true.
So I'm going to have to help people who have fat on their bodies too. So
that's so fascinating. My brain is going to mile a minute because I've never thought about these things.
Yeah. A lot of people haven't. Honestly, when I explain to them that, like some of your low back pain might be because of something happening in your organs, like let's try and see if we can get your organ moving properly, if that will help the low back pain. People are like, what do you mean my organs? So like that's on the front. You need to work on the back.
If you're not studying anatomy, I feel like, a layperson would just not, we don't think about our organs. We can't really feel them, I guess. So we just don't understand where they are and how it's all connected. And it's kind of, I guess none of us really want to think about ourselves as like a meat sack full of blood and guts, but that it really is what we are. It's kind of fascinating. Is there any practice that you would not recommend to a fat patient, or you think that might not be the most helpful approach?
I couldn't say that. No, I think all of them have their valid things. I'm a firm believer for any body type that we all have modalities our bodies like and our bodies don't like. Some people swear up and down about chiropractics and they absolutely love it. And I'm so glad that works for them. For me personally, because of my autoimmune disorder and my just the way my joints are, chiropractics doesn't work for me. It flares me up and it unfortunately doesn't feel good on my body. That's not all chiropractics, but the traditional type. So I just firmly believe that not all modalities are for all people. So, but find your modalities, try everything and see what works for you. Try everything, try different therapists, which I know is asking a lot because accessibility to allied healthcare is expensive and it's hard to find, and it's hard to find compassionate practitioners a lot of the time. But if you have the means to do it, that is the best route, I would say. We kind of touched a little bit on physiotherapy, and that unfortunately, I have lots of friends who are physiotherapists who I adore, and they do amazing work, and they are lovely human beings, but they have kind of branched into a world of like, they're physiotherapists, but they're also like breathwork facilitators and yoga instructors, and kind of, they're not, kind of fall in that jock category so much anymore. Right. But physiotherapists are unfortunately the ones that my fat patients come in and tend to complain the most about their experiences with, because I think physiotherapy is very, very aimed at athletic bodies, unfortunately. This is all obviously opinion and just from my experience and from what I've heard from my patients. And I don't want to say all physiotherapists are like that. There's definitely amazing physiotherapists out there. I personally love my physiotherapist that I go to see. But I think there's definitely, unfortunately, within their education structure, more conversations about athletes than there are about the day-to-day person.
I think too that they tend to have a very narrow idea of what an athlete could be or look like. I remember when I went into the physiotherapy clinic, the sports physiotherapy clinic, really feeling out of place. I think because I felt like people were wondering why I was there. And I remember speaking to my physiotherapist who, can confirm, really seemed like a jock type of guy. And he was very surprised that I had a specific sport and position that I wanted to rehab for, or keep that in mind as we worked on different exercises and what have you. And I think it just surprised him. I don't know that it made him uncomfortable, but I think he just wasn't expecting that. And I wonder, too, if they have such a narrow vision of what it means to be an athlete, that also compromises the quality of care that they're giving, because they're not going to think to ask a fat patient, is there a specific activity you want to work towards, or you enjoy doing and you need to get back to, or what have you. You know, like this idea of an athletic body is often just synonymous with a thin body. And that can be so frustrating for people who are fat athletes and want to have that quality care.
And I've had that exact same experience. I'm a weightlifter and I do yoga. I probably do either one of those two about 4 to 5 times a week. And so when I have an initial intake with, say, any practitioner, they're like, oh, what's your activity level? And I'm like, oh, well, I work out probably 4 or 5 times a week, whether it's weightlifting, yoga, or just like, you know, walking with my dog or my friends or whatever. And they're just like, there's always the, like, my favorite is the, oh, like, not the like shock on their face. It's always this, oh, like,
you can feel them shift. Like, it's a literal shift
of like being like waiting for them to be like, well, I sit at a desk all day and then I move from my desk to my couch and then I get the potato chips and that's where I stay.
Yeah.
You know, and I'm like, no, I'm an exceptionally active person. Like, I'm on my feet all day and then I go to work out, and I'm not somebody who sits still. I'm neurodivergent. I have ADHD. There's no way you're going to get me to sit in a chair. Like, you know, like.
Exactly. And it's not that you need to be fat and athletic in order to receive quality care, but this assumption that you might not have a specific goal in mind, or that, again, like an athlete looks one way. I just can't imagine moving through the world with such a narrow vision or idea of what it means to be a certain type of thing.
Well, and like we talked about with like, where could this improve within the whole, like for all practitioners, it goes back to education. It goes back to making this kind of education mandatory within your schooling process. Not just knowing that it's going to happen at some point, but make the experiences happen. Like you said, make the uncomfortable conversations happen at some point.
I remember once giving a lecture in a kinesiology class, and I'm assuming that a lot of those undergrads were going to go into physiotherapy or some kind of manual practice. And I would say 99% of the class was looking at me like I had 3 heads. They just did not want to believe anything I was saying about teasing apart what they thought they knew about fatness and health. And I remember when the students weren't really asking questions at the end of the lecture, the professor raised his hand and said, you know, I'll start. When I approached Layla to come give this lecture, it came up in conversation that Layla has a dog and whatever. And he said, my first thought was, I felt sorry for that dog because I didn't think it would be possible for a fat person to properly care for a dog. And I remember standing in front of the class and being like, I can't believe he just said that. And I'm standing right here. But you could also feel the tension in the room relax a little bit, because so many of the people in the room were just so resistant to listening to anything I had to say, because they were making so many assumptions based off of what I look like. I received an email from one of the students afterwards that said, I really hope you felt heard. And when I first read that email, I was like, that's such a beautiful thing to say and to offer. And then on second thought, I was like, they're probably saying that because 99% of the people in that room or in that class were not believing a word that was coming out of my mouth. And I can imagine that for you in the industries that you work in, it might sometimes feel like an uphill battle or a hand on your forehead where people are kind of like patting you on the back and being like, sure, you can be fat and athletic, sure. Or like, whatever it is, that these people's conditions have nothing to do with their fatness, or this type of therapy is totally doable in a fat body. Sure. Like it feels really patronizing, and I don't know how to break through that.
Oh, that's going to be generations of work trying to break through that. That's, you know, it's tearing down all of the hard work that the conventional medical system put like so much, like no pun intended, so much weight into how much fat and obesity, the word obesity affects, like, you know, we put so much weight into the concept of BMI. Like, I have a friend whose husband is a surgical resident, and like they still calculate the BMI for the person that's too.
Wild.
It's wild.
How have
to
we
me.
not dispelled that yet? A quick Google search
Yeah.
shows you that it is just a racist, improbable, useless calculation that was never intended for health purposes.
Yeah.
And yet it still reigns dominant in healthcare. It's wild to me.
It's so wild. In healthcare, in applying for health insurance, it's still like when I went to go apply for my critical illness and disability insurance as a private contractor, that was still a question. What was my BMI? I almost like shut down the website and was like, I'm just not going to have insurance. It's fine. Like,
because then you're like, well, what's the point?
Yeah.
I'm banging my head against a wall trying to reason with something that is illogical.
I'm like, can I give you my like blood lipid panel so you can see that I'm super healthy and that like I don't have any cholesterol issues, I don't have any diabetic issues, I don't have any of these like health markers that are associated with my weight. Mm-hmm. Like, why does my BMI matter so much? And I'm not young. Well, youngish. Like, I'm 35, so like I'm in this age range where health issues that start kind of popping up, and I'm not having them, even though I'm in a fat body, because my like, you know, like my fatness doesn't equate my lifestyle.
And I gotta say that even if it did, you still deserve health insurance.
Absolutely. There's a whole whack load of issues with health insurance, unfortunately. But
Totally.
yeah.
But it's just frustrating that even when you're speaking their language, they don't listen. You know, even if you pander to their sensibilities, they still don't listen. And it's just so exhausting. But I'm grateful for the work that you're doing.
Yeah.
And I do imagine that you already have, but especially as you develop your career and bring in your own practice, that you are going to have a very devoted clientele of fat folks who are going to be very grateful for the services and the care that you provide.
Thank you. Yeah. And you know what? And I'm thankful for them feeling comfortable enough to come and be on my table and to tell me their lived experience, because all that's going to give me is more information on how to treat their body.
Totally.
So
thanks for chatting with me today. I appreciate it.
You're very welcome. It was so lovely to come in.
This podcast is produced and directed by me, Layla Cameron. Both audio and video versions of this podcast were edited by Ari Conrad Birch. Each interview was filmed and audio recorded by Rami McHale. Additional video was filmed and edited by Felix Naud and directed by ETW Media Productions. The music for this season is by the band Parlor Panther. Funding for this podcast is supported by TELUS STORYHIVE.